Good morning, everyone. It's great to be with you this morning. I hope everyone is doing well. I want to welcome Dr. LaQuandra Nesbitt, who is the director of the DC Department of Health and really is the frontline person sort of guiding us through COVID in the District of Columbia. Dr. Nesbitt, welcome. Good morning to you.
Thank you. Thank you. Good morning.
So how are you doing? How's your health? How is your staff's health? Are you getting enough rest, getting enough sleep as you go through this?
Yeah, so it's a very interesting time, and I get the question about how's my health, and I get a lot of people making sure to encourage me to practice self-care, and it's always an interesting comment and a question. Often it's dripping with sincerity, and I appreciate that, and then sometimes I get it loaded with a ton of ask and a ton of things to do, and I know that there are some people who are very empathetic or appreciative of the perspective of the role and the position that I'm in terms of managing one of the most complicated situations that our country and in fact our world has faced in over 100 years. Me as the director of the Department of Health and many members of our team that are also finding themselves in one of the most challenging positions that they have been in their career, whether they're new in their career or whether they are at the sort of 25, 30-year mark in their career. And we find it as a collective that we're reminding each other that unfortunately we're in a marathon, we're not in a sprint. In the very early days of managing the pandemic, we were sort of building the response and the framework for the response as we were responding, and now we're sort of getting people into the sort of mindset that this is our new way of working for quite some time, and all of the ways that as a leader, a manager, or someone who is finding themselves very new in public health, having to adjust to what that means for you professionally, and as much as anyone can try to fool themselves, is balancing what that means professionally. What I often say to people, Doug, that the biggest challenge that we find is when we interact with people who are adjusting to what it means to live in a pandemic, is to remind people that we are also adjusting, right? So we have family members who are, older. My grandfather's 92, and so I worry about what this means for him. We have family members who have chronic health conditions, and we worry about how safe they can be. And we have relatives who are college students who are also having their lives impacted. And so even though we're public health professionals and we're providing guidance documents and we're providing guidance, we're not adversely having our social lives and family lives impacted by those same recommendations.
I think that's something people have to remember, that we're all human, and you're doing the job that you're supposed to do, but you've also got a lot of, as you said, family responsibilities and social responsibilities.
Right.
People tend to forget that, and they expect you to come on call 24/7 when there's other things going on. So,
right.
The line I always like to use is, "I'm getting enough sleep to get my job done." So that's a good way to put it.
Yeah, and I am, in fact, I am getting enough sleep. I used to, when people would ask, well, are you getting enough sleep? Are you staying up at night? And I even found very early on that it was sort of, you get home and you're just exhausted with an overwhelming responsibility that you don't find it hard to sleep after the first few days, because the exhaustion of having your mind race constantly sort of mandated that you slept. And I'm an early person. I'm not a night owl at all. And so that same routine of, instead of going to the gym at 5 a.m. Because there was no gym to go to, I'm up still at 4 something in the morning, emailing and having my best thinking during that time. But I'm still crashing at 9 in the same sort of way. So I don't find it challenging to sleep. And people are waking up to my emails in the same kind of way that they would get an email from me while I was waiting to start my workout. So that kind of thing sort of still happens, but I think it's critically important that I have to model the same type of behavior that I'm asking my team members to do. So when I say things like we still have to take a break when our mind is no longer able to be fresh and have new and innovative ideas, if they're not seeing me do that same type of thing, then they don't believe that I think that that's necessary, right? To be able to take a break and restore. So I have to be able to model that same behavior.
So I laugh at myself quite a bit looking back at the start of this and how naive I was, where we stopped working from the office in mid-March. And, I thought, okay, we'll be out for 2 weeks and we'll be back and everything will be fine. How foolish that was. When did you sort of get the sense that this was going to be a months-long crisis that we were going to have to deal with?
Yeah. So very early on, and I have a friend who reminds me that I would tell him very early on that this was going to be a long haul thing. And he constantly reminds me that I told him that this would be a long haul thing. Um, and you tell people that, and even as I sit here and I tell you that I knew this would be a long haul situation, and I would kind of tell people, folks are going to need to settle into their seats and really recognize how we're going to have to work this and how we're going to need to respond to this. And I say that with also wanting to remind folks that the types of behavior, the types of activities that we participate in, we do have the ability to change the trajectory a bit. But understanding that this is going to be a long haul. Pandemics are a long haul, and they can come in waves. When you look at what happened in the early 1900s, there were cycles. There were 3 different waves of cycles. And so you have to, with that type of historical perspective in mind, recognize that we could have cycles. There could be ebbs and flows. There could be better times. There could be worse times. And so with that type of historical perspective in mind, you never want to lose sight of, even when you make really good process, you have containment, we have to still be very focused. The public behavior could change, but we have to be very focused and respond to different clusters that might be able to pop up. And so the type of work and the way that public health does its work doesn't change. And so when I'm sharing with someone that, this is going to be a long haul, you can't make decisions in any period of time that's shorter than 4 weeks, getting people to really understand that back in March, and how I'm giving guidance to my team was sort of how I was communicating to people in my closer circle. How things have been communicated to the public is, I think, a function of how things have even changed so much since H1N1 in 2009, which was when we had our last pandemic, which was a lot different in terms of the global nature, how it moved, where we didn't have so many communities or so many parts of the world impacted at the same time. We were able to have vaccine development much faster than we're able to respond to this novel coronavirus. So, we expect that it takes a while, or it impacts our communities for a while, but the several months on end, I think people have really been taken aback by that. And it's been, the complicating factors of a global pandemic related to the novel coronavirus, and then the unpredictable things that were just completely unnecessary and unjust, such as the racial strife that we're seeing in our community, the unnecessary deaths of Breonna Taylor, Ahmaud Arbery, and George Floyd, which has really amplified some of the other tensions that we have in our country as well.
Yeah, we're all struggling through this unrest and trying to make some sense of it and trying to make some changes. Okay. There's this talk of, is this just a moment or is it a movement? And I think everybody's hoping it's a movement, and we're going to see some lasting change through all this, which is desperately needed here. So what are your worries as we enter the fall with COVID? What are you concerned about?
Well, public health has seasonal variations for a number of things. And people are often talking about flu, but we're the nation's capital, and there are some things that we often think about. We've been in the space of talking about hurricane season, and there's a large public health planning component that deals with hurricane season and how we plan and prepare for that. And you have both in the District of Columbia HCMA, the Homeland Security and Emergency Management Agency, and the Department of Health that plays very critical and vital roles for that. But we're also planning for our every 4-year seasonal variation of the inauguration. And both of those things take a tremendous amount of planning and coordination, and HCMA and DC Health are both critical partners for inauguration. And how we plan and prepare for those types of activities, we plan for months, sometimes a year-long planning process. So you can imagine that as we sit here at DC Health's headquarters, both HCMA's leadership and DC Health's leadership being here since March, so 6 months now, and we're now thick into the planning for inauguration. We're balancing still responding to the pandemic, but preparing for mass vaccination in partnership with community members, and also planning for inauguration. That must happen, right? There will be election of a new president, and there must be an inauguration on January 20th. So these are things that have to happen by law. And so we have to get prepared for those types of things. Here, I've been in DC for quite some time, off and on, and there's this thing that happens called snow. It happens every year. I'm from the Midwest, and it snows there all the time. It begins as early sometimes in September, October. I remember trick-or-treating as a child in the snow, sometimes in the heat. So very unpredictable, this thing called snow. But it happens here every year. And it has happened here sometimes as early as November, as late as January. But it's something that we also prepare for. So we think about the confluence of what happens when you have a virus that is transmitted when people are in close proximity to one another. And as we get into the colder months and people can be in closer proximity to one another with social activities and as well as essential activities, and what that could potentially mean for increased transmission. So as we talk about these things called the flu season, increased risk for transmission of COVID-19 in the fall and winter months, it's really about people being in closer proximity to one another. So I'm thinking in the calculus that I do in my head are things around, well, we still had increased transmission in the summer because of some people not social distancing around the country, with people not social distancing, traveling to areas that were densely populated. And now we have the natural things that happen in the fall and winter months when people are in closer proximity to one another. What is that really going to mean for our increased risk of transmission for COVID-19? Then you add into that the flu season, which begins, we typically think about flu season for October to March. We tend to have our more cases of flu in January, February here in the DC area, even though we begin to see cases in the fall. We don't know how that's going to slide backward or forward in this flu season, which is why we want people to start getting their flu shots now. They're available, so having people get vaccinated for influenza can really if we have a vaccine for flu. So decreasing the number of people who can get sick from flu, taxing our healthcare resources related to flu is going to be critically important. And then again, we've got this thing called inauguration, where we could potentially have people coming from all across the country where rates of influenza and COVID-19 may be totally different than what we're having here in the district.
So you basically just convinced me to move out of the DC area.
No, we're doing much better than other places. We're doing much better than other places.
You are.
The thing that's important to remember, though, is in the district, things like inauguration are called national special security events. When the papal visit happened, that was the 50th national special security event, and half of them had occurred in the nation's capital. So we're pros at this. We do this all the time. But the critical thing to remember is that it's the confluence of all of these events that we have to manage. And so we've got to be laser-like focused. When we're asking the public to be judicious in their actions, we're asking you because we have this level of visibility in our planning where we plugged all these assumptions into it. And we're saying, if we can get the public to do X, Y, Z, this is how we're going to get our best outcome. If the public doesn't do X, Y, Z, we may potentially have a worse outcome than what's necessary.
So what are the X, Y, and Z's for the public? What do we have to do?
Well, it's critically important that people choose their activities wisely. and we get it, and this is what goes back to that human element, right? So I'm human. I've got a grandfather who's 92 and extremely active. This weekend he told me a rocking chair was not made for him. So, we've got parents who have chronic health conditions, nieces and nephews who are college students and really bummed out about not being able to have that experience. And many of them who are in the STEM field, right, where the need to have laboratory experience during college is critical to their ability to be able to compete for grad school and compete in a global economy. And also having relatives who own small businesses, right? So when you think about what the impact is to small business, whether it be restaurant, whether it be childcare facilities, is extremely difficult and challenging for them in this time to be able to figure out how to make it financially and how to pay for the education of that niece or nephew who's in school. So when we think about those things, and we're making recommendations, however, from a public health perspective to say, do carry out instead of dine in. And people say, but that's going to be devastating for the economy. Well, there's other ways that you can think about supporting those businesses that make that economic impact less harmful, but it's also going to be devastating to the economy if people are all sick from COVID, intubated on ventilators and unable to work, and the prolongation of how long we're paralyzed in DC goes on even longer and longer. So we're doing that calculus in our head. So when we talk about choosing your activities wisely, what we're really saying to people is we can turn on some of this economic activity, but everybody can't participate in it every single day and at the same time. So you have to think about, what are you going to do, Doug, on Monday, Tuesday, Wednesday, Thursday, Friday? Are you going to do it every single day? Are you going to do it some days of the week? And are you going to do it in large groups or small groups? What are you going to do with people in your household versus people not in your household? So we can't do everything that we did pre-COVID because we're in a pandemic. So really getting people to think about choosing their activities wisely in a much better way. The wearing of masks is critically important, and wearing the right mask is important. So people like these masks with these exhalation valves or vents. They're not good for us for COVID, right? Because if you have an infection, you're asymptomatic, you may think that it decreases humidity, it makes you breathe a little bit better, but it's letting your potentially infected particles out. So everybody's got to wear a mask or a face covering, a cloth face covering, and you have to do it whenever you're outside of your home, with the exception of if you're doing some vigorous exercise. So we are with the CDC and the World Health Organization on that one. But being able to wear those masks and face coverings are going to be critically important. Wearing them when you're in your office, unless you're the only person in your office, is also important. So remembering to put it up even when you go out to the restroom, in that hallway, doing those types of things are going to be critically important. And most importantly, staying home when you're sick. That even means not declining those invitations to go over to your sister's house or to visit your mom, those family members who this is just a relative. Anytime that you're not feeling in your normal state of health. Some of the cases that we're seeing here where 5 or 6 people are getting sick from the same individual are not because people are going to, events of 30, 40, and 50 people. They're going to the small family gathering of just 10 people or 12 people and letting their guard down. Everybody picking up the same serving spoon, everybody serving from the same, sheet cake, and one person gets sick and then everybody in that family gets sick. That small family of siblings, adult siblings who just wanted to get their kids together. It's okay to do that, but you still have to have some level of having your guard up, because again, we're not in our pre-COVID times, but we've got to be able to do to think more judiciously about our actions and our activity. We don't want people to feel paralyzed. I mean, we want people to still have some level of interaction and engagement, because how we take care of our emotional and mental well-being during this time is critically important. We know seniors are feeling socially isolated. We know children, the best way for them to have their social and emotional development is to be in classrooms. So we want to get back to that state. And knowing that we may not be able to vaccinate the entire general public until sometime next year, we don't know that we need to wait that long, but there's steps that we're going to have to demonstrate we can take to be able to move in that direction sooner than later.
So how are the DC residents doing? How are they in terms of their social activities?
So we have some good actors and we have some bad actors. When some of my public health colleagues who are in the region or who run organizations and think tanks make observations in DC, our mask wearing compliance is really well. We do really well. But then we have a certain population that is the same population across the country, you know, the 20 to 30-year-olds who are participating in social activities, who are, you know, spending time with friends, who are not great social distancers, or who are going to restaurants and they eat and drink and the mask is off the entire time, right? And it's not just when they are actually consuming the food and beverage, it's the entire socialization. And those are the things that are continuing to causing spread. And you know, we're not necessarily in the vacation shaming space, but we've got to be more judicious about where it is that we're traveling, and how when everyone makes the same decision to go to the same place, the opportunities to social distance while you're there are going to be substantially minimized. So if everyone makes the decision to go to the same place on a holiday weekend, then people can't be 6 feet apart. And so people have to really be very thoughtful about those types of things. And what we've seen in DC since mid-July is that we have a lot of people who are traveling to those places where the opportunities to social distance are reduced. And within 14 days of returning to the district, they're reporting an infection. And so we're going to have to really keep our eyes on that. We're not in that category of people or communities that are talked about nationally when it comes to those post-holiday peaks in folks who have traveled.
And how was Labor Day weekend? Yeah.
Well, it usually takes about 2 to 3 weeks to really see the impact of a holiday weekend. And so we'll have to keep our eyes and ears on what's going to happen here as a result of Labor Day weekend.
So what I'm reading is the fear of Labor Day weekend gatherings can help spread it. Kids are back in school in a lot of places. That'll help spread it. It's going to get colder. People are going to do more things indoors. That'll help spread it. I mean, it looks like we're in for a tough fall coming up until there's a vaccine.
But these are things that we know about, right? So we message to people, and we know that people can amplify messages. So, you know, we've been very clear to people about what to do for Labor Day, and we put guidance documents out there. We have documents on our website that tell people if you're going to have a family gathering, this is how you should do it. And we even make sure that people remember not to pass the bottle of ketchup around. So we get very specific in terms of how to responsibly host these types of events. And the more that people can have that in the back of their mind, the better job we'll do as a community. The thing is that people sort of fatigue with this, just as you fatigue with many things that aren't considered to be part of the norm. So we have, and the more our numbers kind of go down and people are sort of like, this is over, or the more you go places and you see that other people aren't being as judicious as you are, then you say, oh, maybe it's over and someone forgot to tell me. No, if you're still being judicious, then you need to get more people to be on your side of being judicious. And that's how we get our numbers down. And what is important for people to remember is prevention is always hard for folks, right? So when the numbers are down, then people tend to think, oh, it's over, we can go back to the way we were. No, the numbers are down because everybody's being judicious. So that's what we have to get people to remember, is that the numbers are down because you're wearing your mask, you're social distancing. When you have gatherings at your home, everybody's following the rules. So that's how we keep our numbers down. And we have to keep doing that, not only until a vaccine is available, but until we have good uptake of the vaccine by the general public, not just those who are in priority groups.
So you're so right about COVID fatigue. One of my brothers announced last week that he's so over COVID. He gets tested every week, he wears a mask, but he's tired of all this, and he just wants to move on. Well, it's not time to do that. So, and the people, when I go places and I see a lot of people not wearing masks, I just turn around and leave.
Right.
That's a very dangerous place to be in. And I'm always struck by people who view wearing a mask as an affront to their liberty or whatever. To me, it's be a patriot, wear a mask. It's a very patriotic thing to do, to put a mask on to help protect this country, because we're not going to get the economy back unless we get control of COVID.
And, at DC Health, we've been a key messenger of, health is related to 9 key drivers, or 9 key drivers are related to health. And, economic opportunity is one of them, education, transportation. I mean, there's plenty of things that are intimately linked with health. It can't be separated. And so we have found it very fascinating that, these conversations of health versus the economy have come up. They're linked. You can't separate them. And so because you can't separate them, there can't be a versus. So that's sort of where we land. We also are part of this, there's this social, collective, and individual responsibility for health. And so we see the wearing of the mask as I protect you, you protect me perspective. And there's lots of different types of masks out there. And so, we've heard people say this one is very uncomfortable for me. Well, then play around with it until you find the type that works for you. And there are, plenty of people who are wearing them for hours on end at work and are able to do it successfully. And so we're sure that some people who are at home for many hours of the day can find the type that would be comfortable enough for them to wear when they are outside of the home for just a couple of hours. And so, again, we're able to provide different types of guidance about which types are the most useful for us in terms of decreasing transmission for spread.
Now, you touched on this earlier, but I do think one of the things that COVID has brought to the forefront is sort of the systemic racism in the country. You didn't believe in systemic racism, you didn't think it didn't exist. Just look at the effect of COVID on communities in the United States and how it has greatly impacted the minority community. So you want to amplify any comments on that, and how's that worked in the district?
Yeah, so, one of the things that I think is extremely important for people to recognize is that the disparities and inequities that we see related to COVID-19 extend beyond anything related to the acute nature of the emerging infectious disease, right? So there's nothing inherent to the immediacy or the acute nature of COVID-19 that has caused the disparities or inequities in COVID-19 health outcomes. So when we see that people of color are diagnosed more with COVID-19 or dying more from COVID-19, it is not anything that is specific to the pandemic itself. These are things that are largely rooted in the systemic inequities that are related to access to healthcare, economic opportunities, educational inequalities, job issues, housing, affordability, and housing stock, all of those things that, again, are key drivers of health across the board. Now, because of the acute nature of it, and because of inequities in healthcare access, and because of inequities in economic opportunity, and because of inequities in housing opportunities, those things are being manifest, and you are seeing them in a spotlight is being shown on them in COVID-19 outcomes. So someone who has been diagnosed with COVID-19 and maybe wasn't diagnosed early enough because they didn't have access to care, or they were worried about the cost. Some states, I have relatives who are in Texas, they are being charged, some people are being charged $200 for a COVID-19 test. In the District of Columbia, you can get a test free 6 days a week, and 7 days in some places in the District of Columbia. If you go to emergency room, you're definitely not going to be charged for it, but you can get 6 days a week non-emergency room-based testing in the District of Columbia, all across the city, all 8 wards. And so we, here, but some people still are not finding the way to be able to access some of the things that we have, that if you need to isolate once you have been diagnosed. And so we find people who live in multi-generational households where the number of people in the household is larger than the citywide average. They end up spreading to other people in the household. And so there's been certain parts of the city where we've had a very difficult and challenging time with being able to decrease rates of infection. Now, we offer free housing opportunities to folks while they are infected. We provide free food. We provide other essential things that they need while they're infected. But how we get that messaging out to folks for them to really trust that those resources are available and that they can access them without any repercussions or adverse consequences has really still been challenging. And we've been partnering with a number of community-based organizations to get that information out there, to push those resources for folks. But those are some of the things that when you really talk about systemic inequities, indeed, many of them have been essential workers who have been working the entire time, working in a number of industries that are critical for all of us who have been able to stay home. So these are folks who work in food retail, who are frontline in healthcare, and they may not be the doctors and nurses in healthcare, but they may work in environmental services. So these are a number of folks who have really been impacted in the most negative ways in our communities of color and our low-income communities in the district. So having to be very thoughtful about how we address inequities, not only in the short term related to COVID, but how we keep our commitment to addressing inequities in the district long term has been important. And when we did our Reopen DC advisory committee, each of those 11 subcommittees had to create an equity focused recommendation that has us reopening the district in a way that is more focused. We're not going to just reopen and get back to normal. We're going to be better. And we're going to be more equity focused around the district's core values of hope, health, opportunity, prosperity, and equity. And so that was critically important for Mayor Bowser, for all of those 11 committees to really have some way of helping to be better at achieving equity in the district as we reopen through our 3-phase reopening process.
So we've got some questions from the audience for you. A couple of them have to do with contact tracing. What's the status of that? And how's that working in the district?
Sure, we get this one all the time. There was a New York Times article about a month ago. There was 5 jurisdictions, including the District of Columbia, that are actually having success at contact tracing. We started with a commitment to have an appropriate number of contact tracers that we could scale up or scale down. We received thousands of applicants that we would have for at our maximum capacity. Let's say when we do some modeling for how many infections we may potentially have on a given day or at a given period of time, that we met at our peak need 900. And our peak that we've experienced so far was back in April. And so we don't estimate that we would get to that number of infections again, daily number of infections again, unless there were some substantial change in our current patterns. What I mean by that is that, you know, we look at the number of individuals who are tested on a daily basis and the proportion of them who test positive, the number of new cases that are reported. So there's been substantial changes in that area, as well as just more information about the spread and a lot more things that the public are doing that we've already talked about. So we have about 400 who are on board. We use a technology solution that helps us communicate with people using SMS messaging to schedule interviews. We also have all of the data recorded, and our staff use a support tool that helps them facilitate the interview. So they're asking all of the same questions. There's fidelity to the interview process. So everybody asks the same types of questions to solicit the contacts. And then a couple weeks ago, we implemented a home visit program. And some of the early findings of the home visit program, I'm going to meet with the team to get even more feedback about it, is that some people didn't really warm to the phone call from the government. And they kind of thought the call was suspicious. But when someone shows up at their home, they were delighted to have someone show up at their home to interview them, to ask them questions, to assess whether or not they had any social needs. And we know that home visits work in public health. We do them for maternal and child health. We do them for tuberculosis work. And we've tried them for a few other chronic health conditions, and they've been successful. So we started that program a couple of weeks ago using our contact tracers. One of the things that I will say is that contact tracing is not uniform across all states and jurisdictions. Some people use them as all they are doing is asking someone who you've been in contact with. We have a more integrated approach in the district, which might be why we've been more successful, where our staff are trained to do both disease investigation and contact tracing. So they get more of a comprehensive history from the individuals, as well as information about who they have been in contact with while they have been infectious.
So what does something like an inauguration do to your efforts to have
Oh,
contact
wow.
tracing?
So,
You've got thousands of
yeah.
people coming in from all over the country. Well, what does that do?
Yeah, so there's a number of state societies and trade organizations that we are members of. As the district, we are both members of city organizations and state level organizations, so that puts us in a really good place. But there is also this organization that all of the state epidemiologists are in. And so we have very good relationships with all of the states and territories. And so when there are these really large events, states have processes that are already built in where we share information about cases across state lines. So when there are big events where people are starting to report that they attended an event in another state, that information readily gets shared across state lines. Many of us are building in what's called exposure notification tools that may help us do that work a little bit better. And we're hopeful that many states will have those tools live by the time that things like inauguration would happen.
We've got another question from someone about, is it better to live in a part of the country with very low numbers or just stay here in the DMV? Get out of town, should you do it? Or
well, of course, my answer is it's better to stay in the DMV. And the reason why I say that, so I'll give you two responses to that. One of the observations that we've had as public health officials is that the areas where cases are has just sort of migrated across the country. If you've been observing that, you'll see that different parts of the country have had their peaks at different periods of time. How high that peak is may be variable. But you'll notice that the Northeast had more cases at one time, then it shifted to the Midwest, and then it sort of moved deep south into the Sun Belt, and now it's moving back to the central Midwest. And so we all sort of kind of cool off and heat up at different periods of time. If you could say the pro, which is a horrible sort of term to use when people are being impacted by a horrible virus and disease such as COVID-19, which causes loss of life, is that we're then able to move healthcare resources around. So we can move ventilators across the country, we can move healthcare personnel who travel across the country to be able to assist and support healthcare facilities and being able to respond. The challenge is the thing that you've asked, is that people start to reimagine or think about, where should I be living? Where is the best place for me to travel, et cetera. When you do things like that, then what we see in other jurisdictions are things like what we call case importation. And that's the reason why the virus travels around the country. So people will see that, oh, things are calm now in the Midwest, so we'll all just take our vacations and travel to the Midwest. And that's a lot of what led to the phenomena that we saw after Memorial Day, after 4th of July, is that our calendars told us that it was summer and we should take vacations. And so people just decided, for those who were listening to public health officials, that, well, we'll just go to the places that don't have as much virus or as much disease. But they tended to be coming from places that had more virus and disease. And so you'd have places that had more virus and disease going to places that didn't have as much, and they would just move disease from one part of the country to the other. And that's not advisable. When the CDC released documents back this spring, you shouldn't go from a place that's hot to a place that's cool, because you'll just move virus from one place to the other. And that's more than likely why we're seeing sort of these hotspot shifts. Maine, for a long time, had no problems. If you all have been following, Maine had a wedding that in a very rural part of the state that has essentially caused, now it's getting close to almost 200 cases from a single wedding, and it's had about 6 deaths as a result of that wedding. And so it's very difficult to predict that someplace that hasn't had as many cases will never have a bunch of cases or a cluster. And that's why we talk so much about the public health infrastructure to quickly and rapidly respond to an outbreak when you have one.
Another question of what does it mean if the antibody test comes back positive, but the COVID test comes back negative for a person?
So antibody tests are still a huge topic of debate, primarily because what antibody test usually means is that for many types of infections is that you've been exposed to something, you've developed an immune response to it, you've developed antibodies in your body, you develop an immune response such that if you were exposed to that virus or whatever again, that you would not be actively infected, that you wouldn't develop the disease that the virus causes. The problem is that because SARS-CoV-2, the virus that causes COVID-19, is such a new virus, a novel coronavirus, that we don't know yet how long someone who has those antibodies will keep those antibodies and therefore be protected. So what we don't know what immunity means. So if you develop antibodies, we don't know how long you keep them. That's why all of the vaccine research that's going on is so critically important. You may develop antibodies, but how long do they last? Do they last for 3 months? Do they last for 6 months? Do they last for a year? Do they last a lifetime? Do they reach a really high level and then go down and plateau? And where they plateau, is that sufficient to give you immunity? So you really don't know how long they last. And is the level that they stay at sufficient to provide you immunity so that you couldn't get infected and develop the disease? A reason why somebody could have antibodies but have a negative test is because the tests do different things. So an antibody test is testing antibodies, which means have you had a past exposure? Antibody tests should never be given to determine if you actually have an acute infection, meaning can you get it and give it to somebody else? Those are PCR tests, real-time PCR tests, which is the nasal swab, or a antigen test, which is often done usually like saliva or something in the cheek. Those are the ones that should be done to determine if you have an actual infection that allows you to spread the virus to other people. Antibody tests should never be done to determine if you actually have what we call an acute infection and can pass the virus on to other people.
Another question on reopening entertainment venues with social distancing and other health precautions put in place. When do you think we might see something like that?
Oh, we don't know. We continue to monitor public health indicators to tell us when that would be appropriate. We've done a lot of managing expectations about how long we would be in phase 2. We let people know that phase 2 would be longer than phase 1. And we need to have more assurance that we are not going to have a substantial number of infections occur. And so, as I mentioned before, when you talk about putting people in large groups and increasing the amount of social contacts and social activity that people have, then you're going to increase the amount of spread. We also have to think about what is it that we want to accomplish? Do we want our children to be back in schools? Do we want people to be able to return back to work? Or do we want to be able to have more social activities in the district for entertainment? And so we have to be able to prioritize those things. All of these things allow for more contacts with each other and the number of cases to increase. And so we have to be able to balance those from a public health perspective.
You mentioned earlier about people's reluctance to share information over the phone when they get a call from someone saying they represent the government and they want to ask you a few questions versus someone showing up to your home. How are you, there's another question, how are you going to communicate once a vaccine's approved and the health and safety or the safety of that vaccine to city residents?
Yeah. So I'm glad you referenced the other thing because I do want to clarify that 80% of our cases do complete the interview. So we've got really good, and that allows me to speak to more about the success of our contact tracing program. So that's why people talk about us being successful, because we've got a really good completion rate on our interviews. And I want to clarify that that is not just of the people who answer the phone. That is of all the cases, 80% of them complete the interview. Because we've got some other states who are like, they give you an 80% number, and if you drill down on it, it's of the people who answer the phone. So we've been very thoughtful, and I'm working on a task force now, a working group, that's looking at what are we really going to do to dispel myths, address misinformation, and deal with the issues of mistrust that are out there around vaccines. And in particular, in communities of color, around how do we really get good uptake of the vaccine when it comes. And we've been in lots of conversations with people who have developed vaccines in the past, who are working on some of the vaccine clinical trials. And I have a lot of confidence about their ability to not support the release of a vaccine that is not both safe and effective, right? So then we get these challenges of things that come out in the media about, states have to have a vaccine plan to distribute the vaccine by, November 1st. And then what the public hears when they hear that is that, oh, they're going to try to rush something out there for us to get that is not yet tried and true. It hasn't been tested. It's not safe. And then the confidence to receive that vaccine is diminished. And so we really have to do a really good job of being able to help communicate what the data around safety and efficacy are. So for example, we're able to every year talk about the flu vaccine, right? So even in the years that the flu vaccine doesn't prevent the flu as much as the prior year, we can still talk about how it may reduce your risk for hospitalization. And that's important to a lot of people. So if you may still get the flu if you get the flu vaccine, but not ending up in the hospital if you're 75 or 80 years old, not ending up in the hospital with influenza or a pneumonia caused by influenza is critically important for someone who has COPD or who has a chronic health condition, where getting influenza and ending up in the hospital could be deadly. So being able to communicate those types of things about the benefits of the vaccine are going to be extremely important. And so how we have access to information about the safety and effectiveness of the vaccine is going to be, of the SARS-CoV-2 vaccine, is going to be critically important. And we'll have access to all of that information. The other part about it too, and I think I mentioned this, is that the amount of the vaccine that is going to be available and over what period of time. And even with H1N1, the amount of vaccine that was available over what period of time, it was over a long period of time. So you start with vaccinating certain populations. So healthcare workers, people who have the highest risk of exposure, are going to be more likely to get the vaccine first. And so there's still lots of conversations going on at the National Academy of Medicine, the ACIP, which is the group that always makes recommendations for vaccines, to talk about, based on who we know is being the most exposed to the virus and having the most deadly consequences of the virus, how are we going to prioritize vaccinating the population? Typically with influenza, we talk about people under the age of 5, over the age of 65, pregnant women, individuals with chronic health conditions. SARS-CoV-2 has had a bit of a different populations impacted. So how are we going to talk about prioritizing populations? And so it's going to be our responsibility to be able to look at that data and say, are these the same populations who participated in the clinical trials? And that's what you hear a lot of Dr. Fauci talking about. If the enrollment in the clinical trials doesn't mimic very closely the populations who have been the most impacted by the virus, then how can we talk about it being safe and effective in those same populations? And those are the types of things that public health professionals, public health officials, those who have done vaccine research before, are holding people's feet to the fire about getting this vaccine out and getting it to the public.
Let me ask you, are there any leadership lessons you've learned over the last few months?
Oh, absolutely. One of the things that I've been most focused on here at DC Health, well, in addition to trying to get people to remember that I'm human, I think that's been the biggest leadership lesson. And I do that all the time. Like I tell people, I don't have a superwoman complex. And people may give accolades all the time and say, you do such an amazing job. How do you speak without notes? All of these things that people, applaud you for when you're in a role. And I'm like, I'm no unicorn. I think that while I think that I do a great job, and I think that, yes, I think I'm eminently qualified for the role that I have, and I'm very proud of the things that I have accomplished. I'm no unicorn, and I'm human just like everyone else. But I've also been mindful too, in conversations with my team, ask people to take in the magnitude of this moment, right? You are a team member at the DC Department of Health, helping to respond to a pandemic, right? This is like in 100 years, something that is impacting people's lives in this type of way has not happened. And you're going to be a person who is making a decision without someone over your shoulder. Your critical thinking skills are going to be amplified in ways that you have not imagined. Your need to take care of yourself and your family has never been more critically important. And so, what are you doing to take in this moment? If you don't journal, you should start now. Like, there are going to be things that you are going to need to think back on, or you're going to reflect on 10 years from now, 15 years from now, 30 years from now, that you don't really appreciate day to day in the moment, that are going to be so pivotal in your life, that are changing the core of who you are every single day, that you just don't really have the opportunity to just bask in, to drink in, to like really appreciate right now. So how do you do that? And that I've been able to just speak to my team and just get even if you're not in a management position, you don't see yourself in a leadership position, like, you are leading this response in some type of way. Like, the phone rings here, so you have to answer it, and someone is expecting you to direct them in a way, because we are the lead agency for this response. And so in those conversations, I've really been able to appreciate how I am in ways that are far different than I know on a daily basis. I'm cultivating a cadre of leaders for things that I just don't even have the ability to appreciate. There will be people who will take off from this agency after this experience to things that I just can't even conceive of, because of the experience that they are getting right now and the skills that they are cultivating right now. And that just makes me just so tremendously proud that the way that I interact with them, the way that I engage with them, in the moments that I take a deep breath, be very thoughtful about the way that I respond, and the way that they then respond as a result of how I respond, is impacting someone's life personally and professionally, and will be felt in ripples beyond my wildest dreams and imagination.
Dr. Nesbitt, this has been extraordinary. Really, really appreciate this conversation. If people want to take use of or make use of the meal and housing options that you had talked about earlier, where should they go?
Sure, we have a number of community-based organizations that are partnered with us, but everyone can always go to coronavirus.dc.gov for information, or email us at coronavirus@dc.gov for more information on any of our programs. Our Emergency Operations Center operates 7 days a week. We have staff on hand who can always respond and give people the resources that they need.
And Dr. Nesbitt, thank you so much. This really, as I said, been extraordinary. It's been a lot of great information. I can't thank you enough. We've got the site up on the chat box now for people to take notice of. And let me just leave you with the final word.
Oh, sorry.
Or the final drink, whatever you want.
I just want to say that we really embrace and have a whole of community approach here in the District of Columbia. And we've just been very thankful and grateful for everything that our residents have done, that we've asked them to do, and all of our business and community leaders who have really, as you've mentioned, Doug, adapted to this tremendous challenge during these unprecedented times. And again, we know that there's been so much that we've asked of people that has been a challenge. We know that there are still, unfortunately, probably some more challenging times ahead. And we recognize that we are all in this together. We're all still learning so much together. And we just appreciate all of the support and the patience that people have had as we have moved through these unprecedented times together. So I'm just thankful and grateful to have had the opportunity to share with you all this morning. I look forward to continued partnership.
Thank you very much. I want to thank PNC Bank for sponsoring these conversations, allowing leadership here to Washington to be able to do this on a weekly basis. And everybody stay tuned for our next online conversation next week. Thank you very much.